Heart attack when no one's around. 3 life-saving steps you must take. If you ever feel sudden pressure in your chest, pain moving into your arm, shoulder, jaw, or back, or you become short of breath while you're completely alone, don't wait to see if it goes away. Every minute matters during a heart attack. Acting quickly can help you get emergency care sooner and may improve your chances of surviving while reducing damage to your heart. Welcome. I'm Dr. Harrison Black, and on this channel, I share practical, evidence-based health information to help adults over 60 better understand their bodies and make informed decisions for healthier aging. Today, you'll learn 3 simple but important steps that can help if you think you're having a heart attack and no one is around. These steps are not meant to replace emergency medical care, but they can help you respond quickly while help is on the way. Before we begin, I'd like to ask you something. Have you or someone you love ever experienced a heart emergency? Share your experience in the comments. Your story could help someone else recognize the warning signs before it's too late. Your heart is a strong muscle that needs a steady supply of oxygen-rich blood every second. That blood travels through small blood vessels called coronary arteries. During a heart attack, one of these arteries becomes blocked, most often by a blood clot that forms on top of a buildup of fatty plaque. Think of it like a traffic jam that suddenly stops every car from reaching its destination. Without enough blood, part of the heart is left without the oxygen it needs. Within minutes, the heart muscle in that area begins to suffer. The longer the blockage remains, the more damage can happen. That's why doctors often say, time is muscle. Acting quickly gives healthcare teams the best chance to restore blood flow and protect as much of your heart as possible. Many adults over 60 do not realize they are having a heart attack because the symptoms are not always dramatic. Instead of severe chest pain, they may feel pressure, unusual tiredness, shortness of breath, nausea, or discomfort in the jaw, back, or shoulder. Some people mistake these signs for heartburn, indigestion, or simply getting older. The most important thing to remember is this: do not spend precious minutes trying to figure out exactly what is happening. If the symptoms suggest a heart attack, it is much safer to treat the situation as an emergency and get help right away. Now, let's talk about the 3 actions that matter most if you're completely alone. The first and most important step is to call your local emergency services immediately. If you think you may be having a heart attack, do not try to drive yourself to the hospital unless there is absolutely no other option. Your condition can become worse without warning. You could become weak, confused, or even lose consciousness while driving, putting both yourself and others at risk. Every minute counts because the blocked artery continues to damage your heart muscle. The sooner trained medical professionals reach you, the sooner treatment can begin. Emergency responders can check your heart, monitor your breathing, give oxygen if needed, and provide life-saving care while you are on the way to the hospital. That early treatment can make an important difference. The American Heart Association advises people with symptoms of a heart attack to call emergency services right away rather than waiting to see if the pain goes away. Hoping the symptoms will pass may waste valuable time when your heart needs help the most. After making the call, if it is safe to do so, unlock your front door so emergency responders can reach you quickly. Put your phone on speaker so you can follow the dispatcher's instructions without holding the phone. Stay as calm and still as possible. If you begin to feel dizzy, very weak, or think you might faint, do not try to walk around your home. Stay where you are, keep talking to the dispatcher if you can, and wait for help to arrive. The second step may help in some situations, but only if it is safe for you. If you think you are having a heart attack, chewing a regular aspirin may help slow the growth of the blood clot that is blocking blood flow to your heart. Think of the clot as a pile of sticky bricks. Aspirin makes it harder for more bricks to stick together, giving doctors a better chance to restore blood flow. You may wonder why people are often told to chew the aspirin instead of swallowing it whole. Chewing breaks the tablet into smaller pieces, allowing it to be absorbed more quickly. That means it can begin working sooner than a whole tablet that must first dissolve in your stomach. Guidelines from organizations such as the American Heart Association support the use of aspirin for some people who are having symptoms of a heart attack. However, this is not the right choice for everyone. Do not take aspirin if you know you are allergic to it, if your doctor has told you not to take it, if you have active bleeding or a bleeding disorder, or if the emergency dispatcher tells you not to take it. If you are unsure, ask the dispatcher what you should do while help is on the way. The goal is to act quickly, but also safely. The right action at the right time can make an important difference. The third step is to stay as calm as you can, rest, and prepare for help to arrive. This may sound simple, but it is very important. During a heart attack, your heart is already struggling to pump enough blood. Every extra movement makes it work harder, like asking a tired runner to keep sprinting after they have already run out of breath. As soon as you have called emergency services, sit down or lie in a comfortable position. Try to stay still and take slow, steady breaths. If your clothing feels tight around your neck or chest, loosen it so you can breathe more comfortably. If you have not already done so and it is safe, unlock your front door so emergency responders can get to you without delay. Keep your phone close and on speaker so you can hear instructions from the dispatcher. If your doctor has prescribed nitroglycerin for chest pain, take it exactly as directed. Do not take someone else's medication or change the dose on your own. Just as important is knowing what not to do. Do not take a shower, because you could become dizzy or collapse. Do not eat or drink unless a medical professional tells you to. Do not try to walk off the pain or finish the task you were doing. Stop immediately and focus only on getting help. Your goal is not to be brave or tough. Your goal is to give your heart the best chance to keep working until trained medical help arrives. Many people picture a heart attack as sudden, crushing chest pain that causes someone to fall to the ground. While that can happen, it is not the only warning sign. In adults over 60, the symptoms can be much quieter, making them easier to miss. The most common signs include pressure, tightness, or pain in the center of the chest. The pain may spread into one or both arms, the shoulder, the neck, or the jaw. Some people also break out in a cold sweat for no clear reason. These are classic warning signs that should never be ignored. But there are also less obvious symptoms. You may suddenly feel very tired, even after doing little activity. Some people feel sick to their stomach, or become nauseous. Others notice pain in the upper back, trouble catching their breath, or a feeling of dizziness or lightheadedness. These symptoms can seem mild at first, but they can still signal a heart attack. Women and older adults are more likely to have these less typical symptoms. As we age, the body's warning signals do not always follow the usual pattern. That is why some people mistake a heart attack for indigestion, the flu, or simple tiredness. If several of these symptoms appear together, especially if they come on suddenly or feel unusual for you, do not ignore them. It is always safer to treat the situation as a possible heart attack and get emergency help right away. Many people do not lose valuable time because they do not know the symptoms. They lose time because they hope they are wrong. That is one of the biggest mistakes during a possible heart attack. One common myth is to wait 20 or 30 minutes to see if the pain goes away. Every minute you wait is another minute your heart may not be getting enough oxygen. It is much safer to call for help early than to wait until your condition becomes worse. Another mistake is driving yourself to the hospital when you could call emergency services. A heart attack can become more serious without warning. If you become weak, dizzy, or lose consciousness while driving, the situation becomes even more dangerous. Many people also tell themselves, "It's probably just indigestion." While heartburn can cause chest discomfort, a heart attack can feel very similar. If you have chest pressure, pain that spreads, shortness of breath, or other warning signs, do not assume it is only a stomach problem. Some people take random pain medicine, hoping it will make the pain disappear. Others lie down for a nap, thinking they will feel better after some rest. These choices can delay the emergency care your heart needs. Finally, never let embarrassment stop you from calling for help. Some people worry they might be wrong or bother emergency workers. But emergency teams would much rather check on someone who turns out to be safe than arrive too late for someone who needed immediate care. Acting quickly is never something to feel embarrassed about. If you live alone, the best time to prepare for a heart emergency is before one ever happens. A few simple steps today can help you respond more quickly if you ever need help. Start by keeping your emergency contacts up to date on your phone. Choose someone who can answer quickly and knows about your health. Keep your phone charged and within reach, even when you are at home. Many heart attacks happen during normal daily activities, so having your phone nearby can save valuable time. If your doctor recommends it, wearing a medical ID bracelet or necklace can help emergency responders learn important information about your health, especially if you cannot speak for yourself. It is also wise to keep your medications organized. Store them in a place that is easy to find, and know exactly where they are. If your doctor has prescribed nitroglycerin, keep it where you can reach it quickly. If your healthcare provider has advised you that aspirin is appropriate for you during a suspected heart attack, know where it is stored as well. Never use either medication in a way that goes against your doctor's instructions. Finally, take a few minutes to learn the warning signs of a heart attack before an emergency happens. Just as people practice a fire escape plan, it helps to have a simple plan for your heart. When you already know what to do, you are more likely to act quickly instead of losing precious time trying to decide what is happening. Before we finish, let's go over your 3-step emergency action plan one more time. First, if you think you may be having a heart attack, call your local emergency services immediately. Do not wait to see if the symptoms go away, and do not drive yourself if help is available. Second, if it is safe for you and your doctor has not told you to avoid aspirin, chew a regular aspirin while waiting for emergency responders. Do not take aspirin if you are allergic to it, have active bleeding, have been told not to take it, or if the emergency dispatcher advises against it. Third, sit or lie down in a comfortable position, stay as calm as you can, keep your phone close by, and wait for help to arrive. If you have prescribed nitroglycerin, take it exactly as your doctor instructed. These steps cannot stop every heart attack, but acting quickly can make a meaningful difference. Most importantly, they are never a substitute for emergency medical care. The sooner trained professionals begin treatment, the better your chances of protecting your heart. If you found this guide helpful, please subscribe to the channel. Each week, we share practical, evidence-based health information to help you and the people you love stay safer and healthier as you grow older. This video is for general educational purposes only and is not personalized medical advice. If you think you are having a heart attack, call your local emergency services immediately and follow the instructions of your healthcare professionals.